Recollect the experience of seeing a person suddenly having a severe attack, falling to the floor unconscious, with his hand or legs continuously twitching or moving uncontrollably, drooling or froth from the mouth, or even losing bladder control. Within minutes, the attack is over, and the person regains consciousness but is exhausted and dazed. This is the image most people have when they hear the word epilepsy. This strange behavior caused by some disturbance in the brain has contributed through the ages to many superstitions and prejudices. The word epilepsy is derived from the Greek word attack. What is epilepsy? Epilepsy is a brain disorder in which nerve cells or neurons in the brain sometimes signal abnormally. Many believe that having a seizure equates to having epilepsy. Although the two terms are often used simultaneously, a seizure is a single sudden electrical discharge in the brain causing alterations in behavior, sensation, or consciousness. Whereas epilepsy is defined as two or more unprovoked seizures. Seizures are fundamental elements of epilepsy, but not all seizures are manifestations of epilepsy. In India, around 5 in 1,000 population suffer from epilepsy. Epilepsy is more common during early childhood and after the age of 60. Causes of epilepsy. Epilepsy may develop because of an imbalance of nerve signaling chemicals called neurotransmitters. In about half of the people, the cause of epilepsy is unknown. When there is a cause that can be found, it can be head trauma, genetic factors. Some types of epilepsy run in families, and researchers have linked epilepsy to specific genes. Diseases such as AIDS, viral encephalitis, and meningitis. Prenatal injury. Babies are sensitive to brain damage that could be caused by several factors, such as an infection in the mother, poor nutrition, or oxygen deficiencies during pregnancy. Who is likely to develop epilepsy? Some things make seizures more likely for some people with epilepsy. These are often referred to as triggers. Triggers are things like stress, insufficient sleep, drinking too much alcohol, missing meals, not taking your epilepsy medications, and exposure to lights that flash or flicker. Certain factors may increase your risk of epilepsy, such as age, more common during early childhood and after the age of 60. If you have a family member suffering from epilepsy, brain infections can increase your risk, hence should be treated properly. Past history of head injury due to accident. Symptoms. Symptoms vary from person to person. Some people may have simple staring spells, while others have violent shaking and loss of alertness. Some people with epilepsy have a strange sensation such as tingling, smelling an odor that isn't actually there, or emotional changes before each seizure. This is called an aura. Commonly, epilepsy presents as intermittent fainting episodes and frequently followed by extreme tiredness, unresponsive to instructions or questions for a short while, sudden bouts of blinking without apparent stimuli, repetitive movements that seem inappropriate. In adults, arms, legs, or body jerks, whereas in babies, these will appear as cluster of rapid jerking movements. Drooling or frothing at the mouth, loss of bowel or bladder control, grunting and snorting, teeth clenching, temporary halt in breathing. The person may have warning symptoms before the attack, which may include fear or anxiety, nausea, visual symptoms such as flashing bright lights, spots, or wavy lines before the eyes. What are the different types of epilepsy? Doctors generally classify seizures as either focal or generalized based on how the abnormal brain activity begins. Seizures that appear to begin everywhere in the brain at once are classified as generalized seizures, while those beginning in one location of the brain are classified as partial seizures. In generalized seizures, abnormal activity occurs in both halves of your brain. You lose consciousness during this type of seizure, although sometimes it can be so brief that no one notices. The muscles in your body may stiffen and/or jerk. In partial seizures, abnormal activity occurs in any one part of the brain. However, consciousness is not impaired. The patient may experience unusual feelings or sensation along with the inability to speak. How is epilepsy diagnosed? The doctor will ask questions about the seizures and any past illnesses or other symptoms a person may have had. Since people who have suffered a seizure often do not remember what happened, caregivers' accounts of the seizures are vital to this evaluation. The doctor may advise various tests to determine whether a person has epilepsy and, if so, what kind of seizures the person has. These tests include electroencephalography or EEG monitoring, brain scans, blood tests. An EEG records brain waves detected by electrodes placed on the scalp and can detect abnormalities in the brain's electrical activity. Brain scans like CT and MRI scans reveal the structure of the brain, which can be useful for identifying brain tumors, cysts, and other structural abnormalities. Blood samples are often screened for metabolic or genetic disorders that may be associated with the seizures. How can epilepsy be treated? Accurate diagnosis of the type of epilepsy a person has is crucial for finding an effective treatment. Medicines can help to manage the epileptic attacks by stopping or reducing the number and frequency of attacks. Your doctor will consider your condition, frequency of seizures, your age, and other factors when choosing which medication to prescribe. What to do during epilepsy attack? It is important that people who work and live with you know the correct way to handle a seizure in case they are with you when you have one. The main goal is to protect the person from injury. Whenever there is an attack of epilepsy, try to prevent a fall. Lay the person on the ground in a safe area. Clear the area of furniture or other sharp objects. Cushion the person's head. Loosen tight clothing, especially around the person's neck, and turn the person on his or her side. If vomiting occurs, this helps make sure that the vomit is not inhaled into the lungs. Stay with the person until he or she recovers, or until you have professional medical help. Meanwhile, monitor the person's vital signs, that is, pulse and rate of breathing. Don't try to put your fingers in the person's mouth. Do not force anything between the teeth. Attempting to put an object, such as a spoon, in the mouth to protect the tongue should not be tried. Such efforts can do more harm than good. The teeth may be damaged or the patient may bite the helper unintentionally. Don't try to restrain someone having a seizure. In any condition, do not make patients smell substances like onions, shoes, etc. Do not move the person while the seizure is in progress, unless he or she is in immediate danger. Do not try to give anything by mouth until the convulsions have stopped and the person is fully awake and alert. Complications. Although most people with epilepsy can lead a full and active life, they are at a risk of complications. Having a seizure at certain times can lead to circumstances that are dangerous to yourself or others. If you fall during a seizure, you can injure your head or break a bone. Similarly, a seizure during driving can cause a car accident either due to loss of awareness or control. If you love swimming, be careful, as you're more likely to drown if you get an attack of seizure while swimming or bathing. Since epilepsy affects the quality of life, you are more prone to develop psychological problems, especially depression and anxiety. If you are planning to conceive, remember that certain anti-epileptic medications increase the risk of birth defects. Though most women with epilepsy can become pregnant and have a healthy baby, it is advisable to discuss it with your doctor before you plan your pregnancy. Living with epilepsy. One of the biggest concerns for people with epilepsy is how it affects day-to-day life. Most people with epilepsy lead outwardly normal lives. Approximately 80% can be significantly helped by modern therapies. Tell the people close to you, like your friends, relatives, teachers, about your epilepsy, and teach them what to do in case you have a seizure when they're with you. Here are some tips for living with epilepsy. Make sure you get at least 8 hours of sleep every day. Lack of sleep is known to trigger epilepsy. Take your anti-epileptic medicines at a regular time every day as specified by your doctor. Eat proper, balanced meals and drink at least 6 to 8 glasses of water per day to maintain hydration. If you go swimming, take someone with you who knows what to do if you have a seizure in the water. Do not work on the computer for too long at a stretch. Take adequate breaks. Too much television viewing is dangerous too. Certain patterns and colors are known to trigger epilepsy. Don't take or stop any medicines without your doctor's advice. Try avoiding driving alone as far as possible. You can live a normal life with epilepsy and do what everyone else does, provided you take all possible precautions to keep yourself as safe as possible.